Hi, my name's Manoj Krishna. I'm a spine surgeon. And today I want to present an interesting case of a lady who had 18 years of back pain, but repeated MRI scans had shown no abnormality. This can sometimes happen if there's a tear inside the disc, but the disc is actually not degenerated. As you can see on this MRI, where the arrow shows a slight loss of the disc height at that level, and clinically that was the point where she was maximally painful and tender. On the cross-sectional image, there's a slight bulge at this level, and that was the other clue, but not enough to consider surgery. So we did a test called a discogram, where under sedation, we put a needle into the disc and inject some dye in it, and this reproduced the pain that she normally experiences. This view shows a side view of the spine, a lateral x-ray, and you can see how the dye has leaked throughout the disc. So we followed this up with surgery, with a posterior lumbar interbody fusion where the disc was removed, a cage was inserted in the disc, and screws and rods inserted to back that up. This is the x-ray looking at it from the front, and you can see the two plates on either side. Here is Rachel telling her own story. Afternoon, Rachel.
Hello,
So, how old are you, Rachel?
I'm 40.
40.
Yeah.
And tell me a story about your back problem and when it first started.
So we're going back about 18 years ago, and I had sort of an achiness in my lower back, and I went for an MRI scan, and from that I got diagnosed with spinal stenosis. So I've kind of managed that with painkillers and normal limitations for 18 years, and then it's gradually got worse over a period of 6 months. Went for another MRI scan which didn't show up the spinal stenosis anymore, and I was basically left with no diagnosis and no kind of avenue of where to go to next other than to go for physio. So
How bad was the pain and how did it affect your quality of life?
it was pretty bad because I've always been a pretty active person and sort of jogging. I did the Great North Run and things like that, and all of that had to stop because I really struggled to walk even a mile. And I'd taken painkillers on a daily basis.
What were you taking?
Codeine phosphate and anti-inflammatories. So I was taking those, my maximum dosage every day, and it wasn't really alleviating the pain very much. So
Was sitting affected?
yeah. So which affected me in my work because I have a desk job, so I had to take a little bit of time off work for that. And it was the physiotherapist that I went to see who actually referred me to yourself.
And your sleep was affected as well with this pain?
Yeah. Very disturbed night's sleep. I think because I'd kind of stiffened up more through the night and sort of had to get up and things like that. So yeah, I think really my total life changed really from being quite an active person to being very inactive.
Yep.
So
And was it getting you down? All this?
very much so.
Yeah.
And affecting my partner as well, really.
Yes, of course. So the MRI didn't show too much in the way of degeneration, but there was a loss of disc height at the bottom disc. So we did a discogram, which confirmed the disc was painful.
Mm-hmm.
And we did a posterior lumbar interbody fusion, an operation for you 3 months ago.
Yeah.
Talk me through the surgery and your effect and your recovery and how you are now.
So yeah, I had the operation and very stiff and achy afterwards, and I can only describe it not as pain as such, but just like a really, really deep muscular ache it was, and I had that probably for about a week post-op.
How long were you in hospital?
2 nights. Coming on the Friday, and I went home Sunday just after lunch.
Okay.
So yeah, I was kind of uncomfortable for I'd say about a week. I had clips in. I got those out after 10 days, I think it was. And never looked back from there really. Just sort of improved day on day, week on week.
And you're now 3 months from surgery.
Mm-hmm.
So tell me how you are now.
God, such a change, sort of like 360-degree change, I think, really. I'm sort of walking 4 to 5 miles a day. I've gone back to work, and I went on a phased return, and I'm back up to full-time hours now, so, and I'm managing to sort of sit and do my desk job without too much trouble. Just enjoying life, really.
How much pain do you have?
Very little. Pain as I call it, I don't really have any pain at all. I have a little bit of muscular aches and pains, which is due to me still building up the muscles around the area to give it the support it needs, but don't have anything like I had before.
So the pain you had for 18 years is
Gone.
Gone. Wow. Off your painkillers?
Yeah.
Okay. And sleeping? How's sleep?
Sleep's not too bad. I still do get a little achy through the night, but nothing like I did before.
Rachel, thank you very much.
Thank you.